Carpal tunnel syndrome is caused by pressure on the median nerve. The carpal tunnel is a narrow passageway surrounded by bones and ligaments on the palm side of your hand. When the median nerve is compressed, the symptoms can include numbness, tingling and weakness in the hand and arm. Causes. Carpal tunnel syndrome is caused by pressure on the median nerve. The median nerve runs from your forearm through a passageway in your wrist carpal tunnel to your hand. It provides sensation to the palm side of your thumb and fingers, except the little finger. It also provides nerve signals to move the muscles around the base of your thumb motor function, anything that squeezes or irritates. The median nerve in the carpal tunnel space may lead to carpal tunnel syndrome. A wrist fracture can narrow the carpal tunnel and irritate the nerve, as can the swelling and inflammation caused by rheumatoid arthritis. Many times, there is no single cause of carpal tunnel syndrome. It may be that a combination of risk factors contributes to the development of the condition. Symptoms. Carpal tunnel syndrome symptoms usually start gradually and include tingling or numbness. You may notice tingling and numbness in your fingers or hand. Usually the thumb and index, middle, or ring fingers are affected, but not your little finger. You might feel a sensation like an electric shock in these fingers. The sensation may travel from your wrist up your arm. These symptoms often occur while holding a steering wheel, phone, or newspaper, or may wake you from sleep. Many people shake out their hands to try to relieve their symptoms. The numb feeling may become constant over time. Weakness. You may experience weakness in your hand and drop objects. This may be due to the numbness in your hand or weakness of the thumb's pinching muscles, which are also controlled by the median nerve. Risk factors. A number of factors have been associated with carpal tunnel syndrome. Although they may not directly cause carpal tunnel syndrome, they may increase the risk of irritation or damage to the median nerve. These include 1. Anatomic factors. A wrist fracture or dislocation, or arthritis that deforms the small bones in the wrist, can alter the space within the carpal tunnel and put pressure on the median nerve. People who have smaller carpal tunnels may be more likely to have carpal tunnel syndrome. 2. Sex. Carpal tunnel syndrome is generally more common in women. This may be because the carpal tunnel area is relatively smaller in women than in men. Women who have carpal tunnel syndrome may also have smaller carpal tunnels than women who don't have the condition. 3. Nerve-damaging conditions. Some chronic illnesses, such as diabetes, increase your risk of nerve damage, including damage to your median nerve. 4. Inflammatory conditions. Rheumatoid arthritis and other conditions that have an inflammatory component can affect the lining around the tendons in your wrist and put pressure on your median nerve. You're more at risk if you are overweight, are pregnant, do work or hobbies that mean you repeatedly bend your wrist or grip hard, such as using vibrating tools, have a parent, brother, or sister with CTS. Diagnosis. Doctors can diagnose carpal tunnel syndrome using a combination of your history, a physical examination, and tests called nerve conduction studies. A physical examination includes a detailed evaluation of your hand, wrist, shoulder, and neck to check for any other causes of nerve pressure. Your doctor will look at your wrists for signs of tenderness, swelling, and any deformities. They will check sensation to the fingers and strength of the muscles in your hand. Nerve conduction studies are diagnostic tests that can measure the conduction speed of your nerve impulses. If the nerve impulse is slower than normal as the nerve passes into the hand, you may have carpal tunnel syndrome. How is carpal tunnel syndrome treated? Treatment of carpal tunnel syndrome depends on how severe your pain and symptoms are and if there is weakness. In 2008, the Academy of Orthopedic Surgeons released guidelines for the effective treatment of carpal tunnel. The recommendation was to try to manage carpal tunnel pain without surgery. If possible, non-surgical options include avoiding positions that overextend your wrist, splints that hold your hand in a neutral position, especially at night, mild pain medication, and medications to reduce inflammation, treatment of any underlying conditions you may have, such as diabetes or arthritis, steroid injections into your carpal tunnel area to reduce inflammation. Surgery may be necessary if there's severe damage to your median nerve. Surgery for carpal tunnel syndrome involves cutting the band of tissue in the wrist that crosses the median nerve so as to lessen the pressure on your nerve. Factors that determine success or failure are age of the patient, duration of symptoms, diabetes mellitus, and if there is weakness, which usually is a late sign. The outcome is usually good. Thanks for watching. Don't forget to subscribe.